Welcome to UT Southwestern's What to Know. Dealing with COVID-19 is hard enough, but particularly challenging for people who are being evaluated for or treated for cancer. Here to talk with us today about navigating cancer care during the pandemic is Dr. Madhuri Vusirikala, a leader in our bone marrow transplant program here at UT Southwestern Simmons Cancer Center, and one of her patients, Ericka Thompson. Thank you both for joining us. So Dr. Vusirikala, this virtual health has really changed the way we practice medicine. Tell us a little bit about what that's been like for you and what it's been like for your practice in the care of cancer patients.
One of the things that all new patients who want evaluations are scared about is what do I have and what is the treatment going to be like? And some patients feel that they need to delay their treatment and even seeking help because of the COVID situation. So this virtual care has really helped. As far as established patients are concerned, definitely the whole paradigm of taking care of these patients has changed. I do a lot of allogeneic stem cell transplants. So obviously I like to see them physically when they are fresh out of transplant. But previously, we always saw these patients twice a week in the clinic, but now our second visit in the week has been virtual. There are a lot of things that we can still do using virtual health. We can see whether the patient is uncomfortable, whether they have any skin rash, they are short of breath, there's any swelling. So there's a lot of evaluation we're still able to do via virtual health.
And Ericka, what's it been like for you as a patient? You've had obviously in-person visits with your doctor, and now you've had the virtual visits. Tell us a little bit about the difference and what that has meant for you.
Yes. Well, I'm one of those people who are not very tech savvy at all. So for me, I thought, oh my gosh, it's going to be a little scary. Let me get my kids and my husband involved because anytime there's any new technology or anything, I always get them involved and have them set me up. But surprisingly, I was capable of doing it myself. It wasn't as scary as I thought. It wasn't as complicated to navigate as I thought it would be. Also, the wait time, like in waiting rooms or at the hospital, I don't have to deal with that. We didn't miss a beat in my treatment, and I still am receiving the same excellent care that I would receive if I was in person versus doing it virtually.
So many of our patients are concerned about getting COVID-19, but cancer patients have a particular concern because their immune system might be suppressed by a treatment or drug that they're getting. So Dr. Vusirikala, can you tell us a little bit about how you're speaking with your patients about that and what you're advising them to do?
Our advice to all our patients pretty much has been all the common sense measures, including good hand washing, wearing a mask anytime they are going out, and then using a hand sanitizer. Honestly, all our cancer patients always carry a bottle of antiseptic, but most importantly is avoiding circumstances where they can catch an infection. And then the second thing is if they start by any chance having any symptoms, very early symptoms, to reach out to us immediately so we can have them screened. And if they are having actual infection, to make sure that we evaluate them and put them in the hospital if necessary to take care of all its potential complications.
So Ericka, tell us a little bit about what the last several months have been like for you, how you've been thinking about keeping yourself safe and what treatment has been like for you.
It's definitely been different. I physically was okay, didn't really have any issues there, thank God. But mentally and emotionally, I want to say that that's probably my biggest challenge with the whole quarantine situation and not being able to see my doctor in person and her whole team. Going through this journey, I relied a lot on them emotionally as far as the reassurance and giving me the confidence that everything was going to be okay, and how was a face-to-face going to be different, not having that option and having to deal with that and coping with that on my own at home.
Dr. Vusirikala, early on in the pandemic, we in the medical community had a lot of concerns about patients who might not get care when they needed it because they were concerned about catching COVID-19 at the hospital, at the clinic, or on the way to travel there. Tell us a little bit about that and talk to us a little bit about the importance of keeping these appointments for both screening for cancer as well as being treated.
There are two parts to caring for these patients. One is actually physically seeing a physician, but more importantly, all the diagnostic tests. As a community, UT Southwestern has done an amazing job of making sure the patients are protected well when they're coming for these procedures or tests. And then once those tests are done, the results can be evaluated via telephone if and when necessary. For example, we are able to share the screens of their charts when we do virtual health and televisits. So I am able to show the patient all the lab results, review their bone marrow biopsy reports. Also, we are able to release these results via my chart to them so they actually have a copy of that result when I'm talking to them. So virtual health has actually, to some extent, made this easier for patients as well as physicians to interact, but able to keep the same amount of information going across.
So Ericka, what advice do you have for patients who are undergoing treatment now for cancer?
To definitely not delay any treatment. Make sure that you have a support system around you because we all need that uplifting and encouragement to get through this difficult time. And to make sure you take your doctor's advice and follow everything that they're saying about being safe. We all just want to stay safe and do the best possible.
So Dr. Vusirikala, what's your advice for new cancer patients?
My advice is do not delay your care, do not delay appointments, seek help right away. All healthcare providers are taking extra care to make sure that your treatment and your diagnosis is done very safely. Seek out institutions that are doing virtual care because a lot of the care can be done virtually, but I would strongly suggest do not delay your care. We are here to help you, and please reach out to us.
Thank you for being on the program today and for all the great comments and insight.
Thank you.
Thank you for having me.
Thanks for joining us. We'll see you next week, and until then, stay safe and stay healthy.